If you haven't experienced cancer firsthand, recovery can seem like the end of a long struggle. And in some ways, it is. But for some cancer survivors, the feelings of fear and powerlessness can linger long after they get a clean bill of health. What if there was a way to help them regain their footing after recovering from cancer? Stephanie Koroleski, a psychologist in Omaha, Nebraska, developed what she calls power tools to help cancer survivors better deal with the lingering feelings of vulnerability.
The program is called A Time to Heal, and it's a 12-week holistic rehabilitation program for people who have been through cancer treatment. The people that come to us usually have just finished their cancer treatment. They're usually very frightened and confused. The whole program is focused on choice, having people be able to really look inside and make some conscious choices about what they're doing with their life. And that's harder than it sounds because your mind gets so wrapped up in fear that sometimes you're really sleepwalking through life instead of really being aware and understanding the ways to make the most of the life that you have. So for instance, with all of the programming that we do, we try to first of all look at mindfulness cognitively, like what's your intention? What are you thinking? What are the thoughts that are running through your mind? We talk about resilience and what are your unique characteristics that you can use to build yourself back up and to triumph over this. We talk about fear and how do you recognize when you're operating out of fear or out of defensiveness and not really making choices. And then after we have them sort of cognitively interested in that, every night we teach them a specific power tool. And those are all things that practical applications that they can do right in the moment. When you are dealing with cancer, one of the prime feelings you have is powerlessness. You know, you have an invisible invader in your body. Doctors are making decisions. You can't see the medicine working, and you feel very powerless. And so we want to give them their power back. And one way to do that is to take charge of your mind and be conscious in your behaviors as well. So one of the things that we teach is breath counting. And we've had people come to us and say that they have not had a decent night's sleep, even with all their pills, since they had cancer, maybe several years ago. And after they've practiced the breath counting, they'll come back and say, I didn't think that was going to work, but I'm sleeping through the night now. I've been able to just relax my mind. And that's a wonderful non-pharmaceutical intervention. And we found that the holistic program really results in people showing significant improvement on 5 different measures of quality of life, including happiness and hope, post-traumatic growth, depression and anxiety decrease, quality of life is good. And not only that, but 6 months after the program's over, they've maintained the gains. And I think that goes back to practicing these mindfulness tools.
Practitioners with patients from all kinds of backgrounds have found ways to integrate mindfulness into treatment, whether they're helping people deal with anxiety, depression, trauma, and the list goes on and on. How have you integrated mindfulness into your work? Please share your experience with us in the comments section below.